Does it feel like the world is falling apart? Riots, crimes, addictions, pollution, and natural disaster are on the rise. With heightened political polarization and religious confusion and racial tensions, a person can't help but wonder, what will the world be like for the next generation? I'm Phil Mills, host of the documentary Light Unshackled. As I've traveled the world, I've seen history come to life. I stood in the gas chamber of Auschwitz. Where was God in the face of unimaginable pain and suffering? I walked through the ruins of the sugar plantations in the Caribbean. How long will it take before we understand that all men are created equal? I've seen the bombed out remains of buildings left as memorials of World War II and wondered, where's our world headed? Bible prophecy pulls back the curtain and reveals the future. Join me at the Crossroads Conference, where we'll discover answers to these important questions. You can have hope and confidence for the future. Register to receive your free seat at crossroads.to. I hope to see you there. America is dying. Last year, over 650,000 dead from heart disease. 602,000 dead from cancer. Lifestyle-related illness is the greatest public health epidemic facing our country. Roughly $580 billion is spent on medications that mask the symptoms but fail to address the problem. Many companies are placing private profits above public health. Some have estimated that 95% of all Americans will be overweight in 2 decades. What if everything we've been taught is wrong? The fundamental problem is very few are talking about it. But all of that is changing with the Crossroads Conference in Lansing, Michigan, bringing together medical experts from across America, presenting solid, scientific, and biblical answers. Being healthy is possible. You hold in your hands the opportunity to change. What will you do?
Good evening, everyone. Good evening. Welcome to Crossroads Conference 2022. For those of you that don't know, I'm a new face. My name is Paul Weirmeyer, and I have the privilege of being your MC this evening to fill in for my brother Alex. So just thank you for being here. I mean, how exciting is it to be learning about the things that can make every day that much better for our lives? If you'll recall, we've now been through 3 sessions. Our first was with Dr. Lindy Schwartz, and she talked about the double pandemic, really about things that were leading up to the COVID. Then, on that last Thursday, we had Dr. Azelton speaking to us about the blue zones. How intriguing is it that across the globe, we have areas where we are finding individuals living over the age of 100 years old, and so much of that has to do with their diet and the decisions that they make that have such an impact on their health. This past weekend, on Saturday evening, Pastor Phil Mills spoke about the pain and suffering, the great controversy, and really how the Bible lays out what is happening in the world today. So again, thank you for attending. Speaking of attending, who has been here? Who is this their first night with us? Anybody? We got one. We got a couple. Very good. How many of you have been here at least 2 nights? Very good. How about 3? And how many of you have been here every night so far? 4 nights. That is fantastic. Thank you for making that decision for your lives. I think, as Alex put it, for those of you, if this is your first night, did you get your new hire packet? I think we refer to it as our course syllabus. So with that being said, we are going to get the program started. Again, thank you for visiting and joining us this evening, and we hope that you enjoy the presentation. Now I'm going to invite up Dr. Kim Azelton to cover tonight's life hack.
Well, good evening. Tonight, I'm going to make some bread here, and I'm going to need a little bit of help from you all. Again, this is a life hack, so we're going to learn just a little snippet about how to be healthier. So I have my oil and water and salt here and yeast, but I need my flour. I'm actually going to have to go and buy some flour. I don't have any money. Wonder, I know Vicky, do you think I could borrow some money from you? Is that possible? Thank you so much. She saves me all of the time. I really appreciate it. Thank you so much. That should be just sufficient. So I'm going to go up here and buy some flour because I really need to bake some bread for some stuff coming up. So this, I bought this flour here. It says it's enriched flour. So enriched flour, I'm going to pour some out here. It's like the white flour that you would see. And I'm going to go back and pay. I'm going to enrich Vicky right here. I'm going to enrich her with $2. Do you feel enriched?
No.
Why not?
Because I didn't get back what I gave.
But I mean, I gave you $3.
You did give me 3, but that's still not enough. You didn't give me everything.
Oh. So, just like I ripped her off, right? I mean, I ripped her off, right? Because I didn't pay her back her whole amount. That's what white flour does. So the latest rules that I found was that of the 30 nutrients removed, by law, they have to add back 5. So do you feel enriched? Does your health feel enriched by you get 5 back? Yes. Well, thankfully it's 5 and not 0, I guess. But this is what the original berry looks like. Let's see, it looks like seeds if you can't see it very well. Like wheat berries. So if you go to the next slide, you can see they grind it up. Oh, thank you. If we could go to the slides. So they grind it up and it becomes whole wheat flour with all of the nutrients. Oops, that did not. Thank you so much. And so you can compare that to the white, and I can see it really well. Thought we might have a camera, but this is a lot darker than the white. That nutrients, there's actually a large difference, and that's okay. You can come up and look afterwards. But there's a really, let me show you what the grain looks like on the screen so you can actually see it. So they've removed the hull. It's out in it's kind of the hard part that's not particularly edible. But the whole wheat leaves everything else, all the fiber and the bran and the endosperm and the germ. The white flour, you just have that, that middle portion, the endosperm and germ and things. So if you go to the next slide, there's a fun nutrient comparison tool that you can compare whatever you want as far as nutrients. It's kind of fun. So look at the fiber comparison between these two. Whole wheat with everything, all the money in it, so to speak, is almost 13 grams in a cup of that flour, whereas only 3.3 grams in the white. That's a huge difference. And fiber is actually something related somewhat to what we're talking about tonight, as far as cleaning out your colon and preventing, being one of the pieces that can help prevent colon cancer as far as our diet goes. We actually have a colorectal surgeon here tonight who's going to help you keep your colon nice and clean with all the whole grains that you're going to eat after tonight. Some of the other nutrients that you miss out on in the white flour is actually a lot of the healthy fats. So quiz from the other night, which ones are the healthy fats up there on the screen? Feel free to shout it out. Which ones are the healthy fats? I heard some mumblings out there. Yes, awesome. One of our Renovate folks, the omega-3s. You could also get this in flaxseed, but guess what? It's also, you get small amounts in a lot of your whole grains, the polyunsaturated, the monounsaturated. You can see all of those healthy fats are much higher in the whole grains. That's really important. Some of the other things that you get more of in the whole grain is calcium, potassium, magnesium, phosphorus, zinc, manganese, selenium, vitamin A, lutein, vitamin K, and so on and so forth. All of these are actually really critical to our health when we have a holistic, unprocessed diet. So go after the whole grains. So a little life hack when you're cooking. I like light, fluffy bread and a whole wheat. It's a little more challenging to make nice bread when you have the whole grain bread, if you're wanting to make it yourself or if you're wanting to do baked goods yourself. So I tend to use the whole wheat white from a white berry. That can make it lighter or fluffier. And then also pastry flour is another lighter one. So sometimes I'll mix half of whole wheat and half of one of these flours, depending on what I'm making. And then you can also cheat and go to the store. That's not really cheating, actually. And you can get nice whole wheat and whole grain bread. We're going to actually have a whole another look at fiber next week that you will not want to miss, where we're going to take another look at fiber from a different angle in whole grain. But in between now and then, just look for when it says whole grain on the package if you're going to be buying bread. So that is tonight's life hack. And I'm actually going to pay back Vicki. Don't worry about it. So we have a what's the connection to how does, not just a life hack, but what's the connection to our mental and spiritual health for tonight?
Thank you, Dr. Kim. You all say thank you, Dr. Kim. Appreciate that. It is good to see all of you here this evening. Welcome to Crossroads. I am really excited about your decision to focus on health. So what's the connection? I want to take a moment to connect what we're learning in the area of health with some spiritual lessons that you can walk away with and apply in your life. I find that connection between spiritual and health extremely fascinating. And I think you may walk away with some new insights for you as well. We just heard about wheat. And we saw the wheat kernel that was up there. And we saw that when you take away and you refine wheat and then you superficially enrich it, is the wheat better or worse on the other side? What did we just learn? It's worse. So, it's interesting. In the spiritual realm, God says in His Word that He wants to do a complete transformation in yours and my life. In fact, if you go to Ezekiel chapter 36 or you go to Jeremiah chapter 11, you will find that God talks about taking our lives and completely transforming them. And in fact, in Jeremiah, he talks about taking out the broken heart that we have and putting a new heart inside of us. According to the Bible, who made the wheat berry? God did. And when He made it, did He make it just like it needed to be? And when we come to God and we ask Him to come into our lives and to change our hearts, do you think God gives us the heart just like it needs to be? You think so? Now, what often happens, I'm sure no one here has ever had this happen to them, but what can often happen is just like humanity has done to wheat, so we try to approach what God is doing in our spiritual hearts as well. We start trying to add things in to what God is doing. We start trying to remove things away that God says need to happen. What do I mean? Well, God talks about how He wants a relationship with His people. He talks about how He wants us to spend time with Him, connecting with Him. And He says that we need that time to be able to be living the lives that we need to live. But what happens? We get the new heart from Jesus, and then He says, you need to come and spend time with me to be able to have that relationship that allows me to change you. Well, as we get up in the morning, the pressure of the day drives us out the door, and we have forgotten to get that connection with God. We get busy with everything that's going on in our environment, and we run through the entire day without taking time to connect with Him in prayer and spending time in His Word. What are some other things that can happen? Well, maybe what's going on in Ukraine has you so worked up that instead of reading the good news that's in God's Word, you're focusing on the bad news coming out of Ukraine. And we start stripping away all the things that God has to enrich and to fulfill our lives in that perfect new life that He wants for us. And so over time, we get busy, we get active, we start taking away the key ingredients to true spiritual walking, spending time with God in prayer, spending time with Him in His Word, focusing on that quietness. In fact, there was a study I saw some time ago that was very interesting. They talked about how if the first thing you look at is media as you wake up in the morning, it actually does some damage to your brain. God calls us that first time in the morning should be focused on Him and slowly letting our brains wake up and you're reconnected with Him. So, what happens to your spiritual life as you begin to cut away these critical pieces to the perfect nutritional heart and new spiritual life that God wants to put inside you? Well, I've got this wonderful bread up here. I was looking for Wonder Bread, but they didn't have it at the store, so we got something as close to Wonder Bread as we could. It's in wheat-enriched white bread. Vicki, I'm thinking of you and how enriched you felt when you got $3 back. And as the pressure of life begins to come into our lives, guess what happens to what we think is good? In fact, my daughter would be excited about this. You can take this bread and you can turn it into a bouncy ball. I'm not going to do this, but in another setting, I have thrown it up against the ceiling. We're not going to do that here. But what once looked like a nice piece of bread is now what? A bouncy ball. That's right. You know what Paul talks about this in 2 Timothy chapter 3 and verse 5? He says they have a form of godliness, but they deny the power thereof. We tried to spiritually enrich ourselves with whatever, but we've missed out on the power. I'll tell you, you smush up this whole wheat bread here, and it comes out very different than the bouncy ball because there's a lot more in here. I would encourage you, don't try to artificially enrich your personal spiritual life. Let God be the enricher of your life. Let Him be the one that builds you, and you'll be satiated, fulfilled, and not spiritually in debt. And on that note, I think I'll turn it back to Paul. Thank you all very much.
Well, that's pretty intriguing. I was thinking Play-Doh, not bouncy ball. I was watching you play with it, and I was having flashbacks to sitting in the sandbox with my little brother and playing with Play-Doh. You could do that with bread, I suppose. All right, so next up we have our speaker and our special music. For special music this evening, we are going to have Maya Hall, who's going to play us some music on the harp. Following Maya will be our speaker, Dr. Nelson. Now, Dr. Nelson grew up in Greenville, Tennessee, to physician parents who instilled a love for all things medical. He completed his BS in music at Southern Adventist University in 2002, his MD at Loma Linda in 2006, and then completed a surgeon residency at UC Davis in Sacramento, California. He then moved back to Tennessee, completing a colon and rectal surgery fellowship at the University of Tennessee, Chattanooga, and this was in 2013. He is now an assistant professor of surgery at the University of Tennessee, Chattanooga. Now, during his time in Loma Linda, he was very involved in the health outreach with his wife, who, in parentheses, tells me that she deserves all the credit. Oh, Mr. Mills gave us that one. He started the first medical student-led lifestyle change program, eventually leading to the formation of a new residency, the Lifestyle Medicine Residency at Loma Linda University. During his time in Sacramento, he continued lecturing on lifestyle to area churches and clubs. During a research year, he published on lifestyle effects of prostate cancer. Current interests include surgical education, church planting, and spending time with his wife Rachel and his children Amy and Michael. I think the thing that stands out the most to me on here is the word lifestyle. That's what we're spending a lot of time talking about from the front here, is changing our lifestyles to better suit a biblical model and one that will create longevity in our lives. And with that, I'm going to hand it over to Maya. Take it away.
Well, good evening. I swear I turned my mic on. There it is. Can you all hear me? Excellent. Well, thank you, Maya, for playing. One of the few regrets of my life about my marriage was I didn't have a harpist there to play for our wedding. And I always admire harpists. They have quite the job keeping their instrument tuned. I played violin when I was a music major at Southern, and 4 strings are a whole lot easier than, how many? It's like 50 strings or something on that thing, and they all have to be tuned every time they move it or touch it. Very impressive. Well, I've been asked to have a word of prayer as we begin our time together this evening. Let's bow our heads, if you would, with me. Dear God, we are just so thankful for this opportunity to be together here, and I ask you to bless this time. Help each one of us to be healthier because of it. In your name, amen. Well, the title for my talk in your program was Cancer, Choice or Chance? Based on what I put on the screen, what do you think the answer is? Choice. So we can all go home now. That was a very short talk. I'm here to talk about cancer prevention and what we can do about cancer. I want to thank Terry Dole, who picked me up at the airport today. I flew in from Chattanooga, and he said he's watching the live stream, so hi, Terry. Really appreciate you. I enjoyed our visiting on the way here. And I'm going to just forestall the question that many of you are probably going to ask me afterwards, which is, why colorectal surgery? Why would anybody want to be a colorectal surgeon? And it's actually pretty simple. We're going to talk about a lot of it tonight. Most of the diseases that I treat can be prevented. And I enjoy talking with patients about that. If it's too late for them, at least their family members can benefit. Most of my patients are very happy, and I like happy patients, and it makes me happy to see others happy, and I can help most of the patients that come to me for help, and that leads to job satisfaction. There are certain surgeons, and I won't name which subspecialties they're in, where they don't help very many people, and it's not their fault. It's the disease processes that they are focused on are very difficult. Well, our topic again tonight is cancer, and as I was thinking about this, it suddenly struck me that this is probably a somewhat emotional subject for at least some of you here. I won't ask for a showing of hands, but in any group this size, it's probably at least one of you in this room either has cancer right now or has had cancer. At least one of you, probably 3 or 4. Probably a majority in this room know someone or have a close family member who has had cancer or perhaps passed away from cancer. And so I just want to give a disclaimer that I don't know any of you. And if anything I say tonight comes across as insensitive or just realize I don't know you. I don't know the journey that you've been on. I don't know your family members who have perhaps had cancer, and so I'm going to try to be very dispassionate and present some healthcare information, but none of it is specific to you, your family member, or that friend that you know that has cancer. So be sure to talk with your physicians. But with that apology, turn to the person next to you and answer the question, yes or no, is cancer preventable? I'll give you 20 seconds to discuss. Is cancer preventable, yes or no? Well, you all sound like you made up your mind fairly quickly. What's the answer? Okay, it was actually a trick question. One of those things you want to watch out for in life are logical fallacies and false dichotomies. Here's a better question. What percentage of cancer is preventable? Turn to the person next to you and we'll give you increments of 10. So 0, 10, 20, 30, 40%, all the way up to 100%, right? I'll give you 20 seconds. This is a little harder question. Make a prediction. I'm going to quiz the audience to discover the truth here. What percentage of cancer is preventable? All right, looks like most of you have concluded your assessment. So let's poll the audience. How many of you say somewhere between 0 and 20% of cancer is preventable? Don't be afraid. Don't look around. Just vote. I'm not going to hold you to it. Okay, we have some takers. How many of you say 20 to 40% of cancer is preventable? Okay, a few more takers. What about 40 to 60%? Got a few more takers. 60 to 80%? Okay, and 80 to 100%? Okay, well, we'll give you an answer later on. This is not a trick question, but it's not a very specific question either. Here's what we're going to talk about tonight. I'm going to make a brief introduction and give you a bunch of statistics because I know you all love math. We'll talk about statistics of cancer, and then we're going to talk about the basics of cancer. And then I'm going to talk, for the heart of this talk, about preventive medicine. And I want you to understand when you leave here tonight the difference between primary prevention, secondary prevention, and we won't spend much time on tertiary prevention, but there is such a thing as well. I will address some common misconceptions about cancer and then summarize. Okay, before I go to the next slide, disclaimer, any of you who are squeamish, close your eyes now. Gross medical picture coming up. Ready? Those of you who aren't squeamish, here we go. So again, if you're squeamish, close your eyes. This is what I think those little warning labels on cigarettes should look like, don't you? Smoking can cause a slow and painful death. Now, that's a pretty bad picture, but just imagine a bad breast cancer. I didn't put a picture of that. Imagine a bad anal cancer, and I see a lot of that. I could have put some really, really ugly pictures up here. It reminds me about a story I'll tell you on myself. I was working at a small church plant north of Sacramento when my wife and I were in residency at UC Davis. And I liked that church because they did a lot of health programs in their community. They wanted the whole community to be healthy, kind of like this church. And I was there for, I think, a plant-based meal after our weekend church service, and my wife called me over to the door to the women's restroom. This does not happen often. And then she called me into the women's restroom. That had never happened before, or since, by the way. And so I went into the women's restroom with my wife, and she introduced me to a lady who had just walked in off the street. She liked that church because it was talking about health, and she needed health. She had what I would consider to be undertreated breast cancer that had recurred, and she was anemic from bleeding from not only the primary lesion, but the fact it was invading her ribs, her chest wall. It was horrible. And my wife invited me, and I was a fourth-year surgery resident on my surgical oncology rotation, and she had lost her insurance, and because of that was in a horrible amount of pain, and it was just a bad situation. So we got her connected with some medical care that was for individuals who had a lack of insurance, and we helped her. But cancer's bad. Maybe you know this. Title of my next slide, Cancer's bad, it kills people. And it costs a lot of money. Well, it does kill people. $208 billion, almost $209 billion. That was last year. Probably be higher this year. Only about 10% of that was patients' out-of-pocket expenses, but still, $20 billion. There's a lot of money for Americans to pay for care for cancer. Most of you are aware that The treatment for cancer is sometimes toxic, isn't it? As a colorectal surgeon, I see a lot of patients who had radiation for their prostate cancer, which cured them. But they have radiation proctitis now, and that's a difficult thing for me to treat. They're cancer-free, but the treatment for the cancer has caused some problems. I think all of you are aware that chemotherapy can be toxic as well, obviously. It's a very toxic type of medication. So cancer is bad. It kills people, it costs a lot, and the treatment is sometimes toxic. Here are the statistics. I got these just a couple days ago. That works out to 5,250 new cases every day and 1,670 people dying of cancer in our country every single day. There are different types of cancer, as you know, and as you can see, death rates per 100,000 people. Lung and bronchial cancer is by far and away the most lethal on a population basis. Changed a little bit. These are estimates for this year. On the left side of the screen, you see the types of cancer combined for both sexes there. And you see that breast cancer is by far and away the most common cancer in this country. Prostate cancer is not far behind, so of course women with breast cancer, men with prostate cancer. And lung and bronchial cancer is fairly common as well. I'm the expert in colorectal, if you separate the genders, most common type of cancer, and the second most common type of cancer to kill somebody on the right side of the screen. This is a way to think about it on a more personal level. If you are a woman in this room, your chance of sometime in your lifetime being diagnosed with breast cancer is almost 13%. 13% if you're a woman just because you live in this country. That's pretty significant. Men, you're not far behind. Prostate cancer, 12.5%. Don't smoke. You've all have learned what the Surgeon General has been trying to teach us all this time. I'm proud of you. That can cut that number down significantly. Colorectal cancer, we'll talk about how to cut that down as well, and then it goes down from there. Here's a different way. I know you can't read the screen there, but I just wanted to point out that different types of cancer have a different prognosis. That's all that this screen is saying. Right up at the top there you have prostate cancer and thyroid cancer. And the blue bar is the chance that you personally will survive if you were diagnosed with this type of cancer. Survive. 98% chance. I mean, that is pretty good odds. Of course, we'd all like to avoid cancer, but if you have to have cancer, thyroid or prostate cancer, what you want to get. Right behind there is testicular cancer. Maybe it'd even be a good thing if you men got testicular cancer. Might be the next Lance Armstrong, right? It's interesting that the fact that Lance Armstrong got testicular cancer did play a role in him becoming a championship athlete. Of course, there were a few others. He made a big difference in his VO2 max and things of that nature. He became a better athlete. It's fascinating. After that's melanoma, then breast. Down at the bottom of the list is pancreatic cancer. If you are diagnosed with pancreatic cancer, for all comers, only 11% chance that you survive. Pancreatic cancer is not the one that you want to get. Right above that is the liver and the biliary duct cancers. Well, what about Michigan? I'm from Tennessee, and Tennessee, as you see, is doing very badly when it comes to surviving cancer. We're dying all over the place from cancer. When it comes to death rates from cancer. See all the other states there? Looks like some of Middle America and California are doing much better when it comes to surviving cancer. So much for the statistics. Some of that is somewhat gloomy. On the other hand, prostate and thyroid cancer, not all cancers are created equal. Some cancers are very treatable, very survivable, and others are not so much. Let's talk about cancer basics. I want to make this very, very simple as is possible. There are about 37 trillion cells in your body, according to the Smithsonian Institute. Each one of those cells has biochemical pathways, and those biochemical pathways are what go wrong and then lead to cancer. So I've made this very simple. Here's the simple outline of the cell with the simple I think you can read what's on the screen, right? That's cancer basics. That is the simplest look at some of the pathways, not all the pathways, but the most common ones that affect cancer. Now, I used to know many of those. Back when I was in medical school, I probably understood about half of those pathways on the screen. Some of them I hadn't heard of. When I was doing my research year in prostate cancer and other urologic cancers, I studied the phosphoinositol 3 kinase, AKT, NF-kappa B pathway, which, let's see if I can find it up here. Where's PI3 kinase? There it is. PI3 kinase there, and it shows up a few other places down here. There it is. There, NF-kappa B. So the retinoblastoma gene is up here. Some of these genes have easier names. The retinoblastoma gene, of course, leads to retinoblastoma, a tumor in the back of your eye. Now, the only one that I know very much about is the APC gene, which stands for adenomatous polyposis coli, and that causes familial adenomatous polyposis, or FAP. In that particular disease, if you have a mutation in that gene when you're born, 100% chance you will get colon cancer by the age of about 40. 100% chance. And I would just want to put a side note in here, a plug for parents. Tell your children your family history. I was in clinic and a 21-year-old man came to see me. He'd been married about a year, and he came with a newborn baby. He and his wife were there, newborn baby, and he said, "Doc, I've got some hemorrhoidal bleeding." And I see lots and lots of hemorrhoids. I said, "Great, let's check you out." And what he didn't know is that his mother had not told him that his father, who had been divorced, so he was raised by his mother, his father was a carrier for the APC gene. And his father had passed it on to him. And his mother didn't want him to be bothered with flexible sigmoidoscopies when he's 13, 14, 18 years old. And so she hadn't told him. And he presented with stage 4, very advanced rectal cancer. It was a horrible situation. I've never been so depressed telling a 21-year-old about this. So talk to your kids about your medical history, especially if you have specific cancers. It makes a difference. From my perspective, the one piece of important information is tell them what your colonoscopy showed. How many polyps did you have? What type of polyps? It's very important. Well, so much for the pathways. Let's skip all of those. Let's ask the question, what is cancer? Let's try to make it a little bit more simple here. These 6 items are what define cancer to be cancer. Okay, let's go through these. The first one is self-sufficiency in growth signals. Turns out many of those pathways are signals that the body puts out to tell cells it's time to divide. I'll give you a specific example. You break your arm. You need to make new bone, and so there are signals the body sends to tell the osteoblasts to make new bone and the osteoclasts to remodel that bone to make sure it looks right, to fix your broken arm. Cancer cells don't need those growth signals anymore. They divide and multiply and grow without those signals being present. The second is kind of the opposite of that. Your body also has anti-growth signals. After your bone is fixed, have you ever wondered why the cells don't just keep dividing? You get this big old mass of bone there that maybe just keeps growing. It is because there are anti-growth signals telling it it's time to stop growing, stop dividing. We don't need any more bone tissue. Cancer cells are able to ignore those signals. Okay? Third, tissue invasion and metastasis. Those are 2 slightly different things, but we'll lump them together here for the purpose of this talk. Cancer that is only dividing and growing bigger would not necessarily be dangerous as far as killing you. It might make a big lump, but surgeons can cut that out, no problem. Cancer, however, learns to invade local tissues and spread through other parts of the body. Colon cancer, again, I'll use that as the example, frequently floats up to the liver, sometimes to the lungs. And it's actually very difficult, takes a lot of different mutations for one type of cell to learn to live in a different area of the body, because the milieu, the biochemical pathways around it, are very different. Cancer cells figure out how to do that. Number 4, limitless replicative potential. Cancer cells are essentially immortal. They can just keep dividing forever. They would be limited to about 2 millimeters in size if it weren't for the next item, and that is sustained angiogenesis. Angiogenesis just means making more blood vessels. And if you didn't have new blood vessels formed into a tumor, it couldn't grow beyond about 2 millimeters. So cancer cells learn how to signal the body to make new blood vessels to grow into the tumor so it can continue to get bigger and bigger. Next is evading apoptosis. Turns out the body has lots of pathways that tell the cell it's time to die. If a cell is infected with a virus, sometimes a bacteria, more commonly viruses, if a cell becomes cancerous, the body has many pathways that tell it to undergo apoptosis, which is essentially the cell saying, for the good of the entire body, I am going to allow myself to die. And it does. It involutes and keeps all the badness of the cancer or the virus into itself, and the body comes and cleans up the dead cell. It's interesting to me. I guarantee you that these secular scientists writing in the Cell magazine are atheists. Do you see the symbol they used for apoptosis? Isn't that fitting? Isn't that what Jesus did? Right? He allowed himself to die for the good of others. And that's what apoptosis is. And so they used that. That was fascinating to me. So those are the basics of cancer. If you have those 6 things, that cell is a cancer cell, and it will, left untreated, kill you. That's the basics. Let's move on to preventative medicine. This is the heart of the talk. Preventative medicine is defined as measures taken for disease prevention. And there are several different kinds, as I mentioned. There's primary, secondary, and tertiary prevention. Primary prevention are factors that are taken or things that are done to prevent disease from ever developing. Diet, exercise, immunization, smoking cessation. These things are things that we do to prevent disease from ever forming. Secondary prevention are screening tests to catch something early. So we'll talk a lot about those, but screening tests for cancer such as colonoscopies, mammograms, things of that nature. Tertiary prevention is actually treating the disease after it's already formed, and we're not going to spend any time on that. Now this is very important, and I'm just really excited about this conference because this conference is talking about things that are not talked about very much in this country, but deserve a whole lot more airtime. Primary prevention is the most powerful thing that could be done in our country to make our population healthier. The number one most powerful thing. But most of our healthcare system is focused on tertiary prevention, which is dealing with it once it's already there. A little bit of secondary prevention, mostly tertiary prevention. I'm just really excited about some of these people I see you have coming in the future. Dr. Walsh is actually speaking for my church right now via Zoom, doing some prayer meetings. Dr. George Guthrie is my wife's uncle. He's president of the American College of Lifestyle Medicine. Lifestyle medicine is the most important thing that can be done to make people healthy. Prevention. Primary prevention is the most powerful, and that's lifestyle medicine, but you don't want to change your secondary prevention just because you think you've got primary prevention nailed down. Does that make sense? We'll talk about it a little bit more here. And I strongly recommend that you not use primary prevention measures. Primary prevention is the most powerful thing, but we need to remember it is for prevention of disease. It can treat disease, but it's not necessarily used best, especially when it comes to cancer in that role. So what is the primary prevention for cancer about? What are the bad things? Well, the International Agency for Research on Cancer has a list of 121 items they know, based on good scientific data, cause cancer. That's the bad stuff. So stop it. Just stop it. Well, what are those bad things? There's lots of chemicals used in manufacturing processes and industrial waste sort of situations. There's lots of chemicals. Radioactive nature. I thought when I was coming up here, I added something in my notes here. Maybe Flint, Michigan is the exception, that saying we don't have to worry about these things. How is the water situation? Is it all sorted out by now? Okay, sorted out? I hope so. I hope somebody went to jail about that. That's chemicals you're working with. and what the special handling requirements are. If you have a well, test your well water. Maybe test your basement for radon. But these things in general are not the most important things on the list. And processed meats. We know that these things cause cancer. We'll start with alcohol. How many of you have heard that alcohol is good for you? Have you heard people say this? Some of you have heard this. Some of you are ashamed to raise your hands. You're nodding your heads, but afraid to raise your hands here. Alcohol is I'm just quoting from the safe dose of alcohol when it comes to causing cancer. 0 is the right answer. Alcohol causes cancer no matter what the dose is. And there's lots of different ways it does it. I've listed some of them here. It is an irritant. It is inflammatory. Maybe if you've had alcohol and you've set it on your skin for a while, it causes inflammation in an area. And over time, inflammation encourages cancer. It is a solvent. In the colon, which again is what I'm interested in, it's converted to acetaldehyde, which is a cancer-forming chemical as well. It also decreases your absorption of certain vitamins. Writing, and it's good that they did this. No amount of alcohol is good for the heart. No amount of alcohol is good for the heart. They are willing to look at the risks and benefits, and I'll read something of what they have to say here. I think I'm going to unplug this because it's not allowing me to move my mouse here. They say the evidence is clear. Any level of cardiovascular disease, including coronary heart disease, stroke, heart failure, hypertensive heart disease, cardiomyopathy, atrial fibrillation, and aneurysm. Studies that claim otherwise are purely observational research which fails to account for other factors, such as correlation has been found between moderate alcohol consumption and a lower risk of heart disease. And they put this in italics. The portrayal of alcohol as necessary for a vibrant social life has diverted attention from the harms of alcohol use, as have the frequent and widely publicized claims that moderate drinking, such as a glass of red wine a day, can offer protection against cardiovascular disease, said Monica Aurora, a member of the WHF Advocacy Committee. These claims are at best, that's according to the World Heart Federation. I've listed the harms of alcohol on the screen, but you probably know this. 2.4 million deaths in 2019, the latest data I could get. Leading cause of death for young and middle-aged men is alcohol. There's a lot of economic heart, even from one glass of red wine a day. It's not true. It's actually not true. Let's go on to tobacco. Lung cancer is the most common cause of cancer death, as we saw, and it's also the most preventable. Smokers are about 25 times more likely to get lung cancer, but tobacco causes a lot of other cancers as well. There again is colorectal cancer deaths in this country. Tobacco. So can we prevent cancer? We can easily prevent a third of it if everybody quit smoking. Right there, a third of it gone. On to processed meats. The World Health Organization finally said what most of us have known for years, and that is that processed meats cause cancer. And red meat is in the next lowest down category. It probably causes cancer. Now, here, I originally gave this talk in 2015, and that's when they finally came out and said this. Processed meat, of course, includes bacon, sausages, hot dogs, salami, corned beef, beef jerky, and ham, as well as any canned meat and meat-based sauces. All of those, we know 100% for sure they cause cancer. This was the headline in the Chattanooga Times Free Press back in 2015, and your newspaper probably had something similar to this. Now, I don't know, why do you think it took them so long to say this? Beef industry, yeah. Not just beef industry, but meat industry in general. There's all sorts of politics that go into our food. Don't kid yourselves. Now, why is it that processed meats especially are toxic to our bodies? Well, there's a lot of nitrates used in their processing, and the high temperature cooking causes polycyclic amines to form. Those are cancer-causing chemicals. They have high levels of iron in meat in general, and that's why I wouldn't necessarily recommend that you go out and chow down on Impossible Burgers, and what's the other one? There's Impossible Meat, and there's Beyond Burgers, and it turns out is a cancer-causing mechanism. There's several other mechanisms likely as well. So enough of the bad stuff. Don't drink, don't smoke, don't eat dead animals. I mean, how simple can this be, right? What about the good stuff? What should we be doing? Well, Maintaining a healthy weight throughout life is probably one of the most important things that we can do to reduce our risk of cancer. Be as lean as possible without being underweight. Obesity is a cause of cancer through a variety of mechanisms, and I just would really encourage each one of us, understand what BMI is and aim for the normal range. In fact, the lower end of the normal range is what the American Cancer Society recommends. So if your BMI is 18, 19, maybe 20, that's a good range to be in. Understand BMI. Get regular physical activity, which is a way to do that. Limit high-calorie foods, limit high-calorie drinks. This is, I'll bet anything that if I went to this Renovate program with Dr. Azelton, I'd probably learn a lot about that, wouldn't you think? Yeah, so I'm shamelessly making advertisements for my host here. I would strongly recommend that you consider asking Dr. Azelton what you can do to find tasty foods. In fact, they gave me one of the bags, I assume they gave you as well, and I found a cooking class in here. And in the upper left-hand corner it says plant-based. So I think that's great, and I encourage you to check it out. So, and there's even an exercise class. Look what I found here. Crossroads Health and Fitness. Join one of 4 free classes with experienced trainers. That's like all the good stuff. Just do it. What I found works for me is the small group aspect of doing something together with other people makes it easier, doesn't it? That's why we need each other. We are social creatures. We can't just go this alone. It's pretty easy to say, yeah, lose weight, exercise, eat right, all those kind of things. But it's a lot harder to do it on your own. It's a lot easier when you do it with others. So recommend that to you. Even if you don't lose weight, there are individuals who find it very difficult to lose weight, and there's a variety of reasons for that. Probably Dr. Azelton knows more about them than I do. Even if you don't lose weight, make sure you're physically active. Get that exercise, at least 150 minutes every week, or 75 minutes of, snowshoeing or cross-country skiing or something like that. We need to be physically active. Even if you don't lose weight, your risk of cancer will go down. Okay, so these are 2 independent things. Obesity is a risk for cancer. Lack of physical activity is a risk for cancer. And of course, they're synergistic, but even if you don't lose weight, be physically active. If you can't be physically active, make sure you lose some weight. Ideally, do both of those things. Limit sedentary behaviors. And this is, again, just quoting the American Cancer Society. Doing some physical activity above usual activities has many health benefits. Eat a healthy diet with an emphasis on plant foods. Choose foods and amounts to get to and maintain that healthy weight. And this is, again, quoting them. They said, limit your processed and red meat intake. But they just got done telling us those things cause cancer. Why would I limit it? Why not just eliminate it? Doesn't that make more sense if you're trying to prevent cancer, as I presume the American Cancer Society is trying to do? But again, maybe there was some politics mixed up there, I don't know. Eat 2.5 cups of fruits and vegetables every single day. And we just had this nice demonstration about whole grains instead of enriched, quote-unquote, grains. And I love good whole wheat bread. And if you are still eating white bread, just stop it. It's bad for you. Bad for you. Makes good bouncy balls, though. So here on the next slide is the contribution of diet to cancer. This will partially answer the question we started with. Diet overall, if we all ate an optimal diet, we could reduce cancers by, on average, about 35% in this country. That's only diet. If you look at the different types of cancer, this is an estimate of which types of cancer are most sensitive to the effects of diet. So here's where I'm at, colorectal cancer. I like being able to tell my patients, every single patient that comes into my office gets about a 30-second lecture about plant-based eating. It's healthy. It's not only healthy for your heart and your diabetes and your obesity and hypertension and metabolic syndrome and all those other things, it's healthy for cancer. And they can reduce their risk of colorectal cancer by about 70% if they'll eat an optimal diet. Now, some cancers are not in diet itself, Lung cancer obviously is related more to smoking than it is to diet, but diet does play a small role there as well. So overall, probably about 35% of cancer could be eliminated if we all ate a healthy diet. Now you can't wait, but it's probably true that somewhere around 40 to 50%, maybe a little more than 50% of all cancers in this country could be completely eliminated by lifestyle changes that you personally can do for your health. That is the most powerful thing that our country could emphasize to improve the health of our population. Primary prevention. Let's talk about secondary prevention. If you're doing all those things, do you still need screening? Why? Because it didn't eliminate 100%, right? Does that make sense? I'll tell you a story about Tom, not his real name, of course. He lived in an area immediately north of Chattanooga, and he had a farm. He had eaten plant-based his entire life. He lived on a farm, had well water, which he had tested, made sure there were no heavy metals in it or anything. He exercised regularly. As someone who worked on a farm, he was healthy lifestyle. He understood that his healthy lifestyle decreased his risk of getting colorectal cancer, and he decided he didn't need a colonoscopy until he started bleeding. And he presented with stage 4 disease. Now, fortunately, we can occasionally cure people with even stage 4 colon cancer. And he's still alive today, but it took a lot of surgery and a lot of chemotherapy and a lot of radiation. That slide could be modified depending on how healthy a population is. But don't assume that you're smart enough to modify them yourself. Talk with your doctor first about that. And I'm not sure many doctors are going to be modifying these recommendations. This is the secondary prevention of cancer. If you're a lady, mammograms starting somewhere around age 45 to 50, depending on which guidelines your physician wishes to follow and what your risk factors for breast cancer are. We'll look at colon cancer a little bit more in detail because, again, that's my area of expertise. Women, cervical cancer, start pap smears around age 21. Endometrial cancer, talk with your OBGYN at menopause. Lung cancer, if you have smoked in the past, or of course if you're still smoking, at age 50 you need to start doing what are called low-dose CT scans. These CT scans are less radiation, but they're still effective at picking up lung cancer, better than just a chest x-ray. And the hope is to catch it early. And of course, prostate cancer, talk with your urologist about age 50. It's something that's a little bit controversial, but PSA testing is something that can be done to secondarily prevent or screen for prostate cancer. Let's talk about colon cancer screening here for just a second. I hope none of you think this is gross. I deal with this every day, so this is just old hat for me. We're talking about poop on a card here. Poop on a card. The fecal cult blood test or the fecal immunohistochemical testing. It is a widely variable test depending on how well a job the patient does at home. Some of you have probably had your insurance company mail you a set of 3 cards and they tell you how to, smear it on the card. I see a few heads nodding here. You know what I'm talking about. If it comes up positive, you have to get a colonoscopy. If it's negative, it's pretty good indication you don't have to worry as much about cancer. There are a lot of medication changes and some dietary changes you need to make before doing one of these. And I will ask you, if you go to your doctor, especially men, and the doctor does the finger wave, you know what I'm talking about? Don't let them take that and put that on a fecal cult card. That's a horrible test. It's not accurate at all, and that's not needed. If you are going to do the poop on a card thing, you need to do it every year. And it has been shown to decrease your risk of dying from colon cancer. I'll probably skip Flex Sig here because not many people are doing it. The best exam is a colonoscopy. It's the best exam of the entire colon, and there's lots of evidence that supports it as the gold standard. Every single other screening test, if it comes up positive, you then have to get a colonoscopy. It is that integral part of the risk reduction. If you look at all the big studies, it's somewhere between 50 and 80% reduction in dying from colon cancer if people are following recommendations for getting their colonoscopies. And it's up to a 90% clearing of the colon of all those precancerous polyps that our bodies form. Now, there are disadvantages. Many of you know what those disadvantages are already. It is invasive. That's why we put people to sleep for it. It needs sedation. Are there risks of colonoscopy? Yes, there are. I tell my patients the risk of dying from a colonoscopy is 1 in 100,000, and that's a fair estimate. There have been people who've died from colonoscopies. In fact, when I was in residency, it wasn't us doing the colonoscopy, but I took care of a patient who came in and did pass away from complications from a colonoscopy. It can happen. On the other hand, your risk of getting colon cancer because you live in this country is about 1 in 20. So, you do the math, right? 1 in 100,000 versus 1 in 20. That's why we recommend doing it. It does have a miss rate for polyps. That's highly dependent on how good a job the patient does with the last item here, the bowel prep. The only bad part of a colonoscopy is the night before the colonoscopy. You got to drink all that stuff and you spend all night on the toilet, right? Just getting cleaned out. This leads people to ask, is there a better way? And the answer is probably not, but people are still trying. Barium enemas are not particularly comfortable, so people don't like doing them. CT colonography is not currently recommended first line, but if a colonoscopy is not possible for some reason, it's a good option, but there's some radiation associated with it, and so again, these are not widely used. Cologuard is something that's new on the market, and it is a DNA stool test. So again, it's poop on the card, but it's not looking for blood. It's looking for specific DNA markers of colon cancer. And it is about 92% effective for finding those colon cancers. But of course, colonoscopy is like 99.9%, so it's not nearly as good as a colonoscopy, but it's pretty good. But it's only 42% effective at finding those large precancerous polyps that are very soon going to turn into cancer, whereas colonoscopy finds close to 100% of those. It also has a 13% false positive rate. In other words, you do the test and it comes up positive, and then you get the colonoscopy and it's clean, there was nothing there. It was a false positive. Family history of colon cancer, but it is an option for some folks if they just really don't like the idea of a colonoscopy. When do you start screening with a colonoscopy? What age? Everybody's saying 50, but I heard someone say the right answer. It's changed. It is now 45. That's exactly right. All the societies have pulled the age down to 45. Why? Because although colon cancer rates are slowly declining in our country, largely so they've decreased the risk down, the age down to 45. Now, if you have a first-degree relative who had colon cancer, you're in a whole different category. You need yours at least at age 40, possibly even earlier, depending on what age your father or mother or sibling was when they got colon cancer. So that's secondary prevention. We've talked about primary prevention, which is stop doing the bad stuff and start doing the good stuff. We've talked about secondary prevention, which are those screening tests for cancer, and we focused on colon cancer since that's what I happen to know the most about. Let's talk about common misconceptions about cancer. We'll finish up with several of these. How many of you have heard that fish are healthy for you? Yeah, lots of people have heard that fish are healthy. Is it a healthy meat? Well, would you say it's healthier than salami? Biomagnification. Biomagnification is the fact that as you move up the food chain, here's an example using DDT, but this applies to all toxic substances in the water. We're talking about water because we're talking about fish here. Those toxic substances get concentrated in the larger animals higher up the food chain. For DDT anyway, it's 10 million times higher in the fish-eating birds than it was in the water itself. And it's higher in those fish that eat other fish, or those fish that eat the dead stuff on the bottom. And it's interesting to me, God wanted to prevent us from having problems with this. He foresaw what would happen in the future, and that's why Leviticus 11 and Deuteronomy 14 were written. Turns out that God said, don't eat these fish, and don't eat those birds of prey. They're unclean. They're not kosher, to use the Jewish term. And that's because of the food chain, so you don't get those toxic substances. I go walking at the Tennessee Riverwalk many weekends, and here's a sign there. And trust me, I'm not eating any catfish, but that's what they're warning about. Catfish, of course, don't have scales or fins, which are the things that Leviticus 11 outlines as saying this is a clean animal. And catfish, they're like pigs. They eat everything at the bottom, and it's horrible. Here's the next common misconception. So we talked about fish. I put this one in big, bold letters because if you walk away with nothing else tonight, you have to understand this concept. Association does not prove causation. Why don't we say that all together? Association does not prove causation, or does not equal causation. Association does not equal causation. You must understand this. To help you understand it, I put together some graphs. Actually, I stole some graphs off the internet. Divorce rate in Maine is very highly correlated with per capita consumption of margarine in the United States. I mean, look at these two graphs here. Divorce rate in Maine is the red line. You even got a little bump there. Per capita consumption of margarine, right along with it. I mean, those graphs look like they match right up, don't they? We've got a little statistics here. Here's per capita consumption of mozzarella cheese along with civil engineering doctorates that have been awarded in our country. And I know this is too small for you to read, but the number up here, the correlation coefficient is 0.958648. That's incredibly statistically significant. I mean, these lines just match up very nicely, statistically speaking. They correlate very well. They are associated very tightly. Here, people who drowned after falling out of a fishing boat and marriage rates in Kentucky. Well, there's a few little bumps up and down there, and the marriage rate in Kentucky up here. But U.S. crude oil imports from Norway and drivers killed in collision with a railway train. I mean, look at those. Again, the number up there, 0.954509. These are very tightly statistically related graphs. I think I might have one more. Math doctorates awarded and uranium stored at U.S. nuclear power plants. Again, very tightly statistically correlated. They are associated. Does anybody in this room believe that these two things are causatively related? In other words, the amount of margarine that is eaten in this country affects the number of engineering degrees? I don't think anybody really believes that, right? I mean, these are obvious. But our brains kind of shut down when we already believe something to be true. And I'll give you a specific example about that. Let's talk about vitamins and supplements and extracts and herbal potions and stuff that many of us believe do us good. I'm not going to argue about them with any of you afterwards, but I'm going to talk about cancer specifically. It turns out that there are thousands of studies that show a lower risk of cancer in populations that have good levels of vitamin E or vitamin whatever or some mineral or whatever. Thousands of studies that show an association between good levels of some vitamin and a lower risk of cancer. I'll give you one specific example of why 99.99% of those, when they are studied in a randomized controlled trial to figure out if that association does equal causation, come up negative. Here's just one example. Do you understand what a randomized controlled trial is? Okay, let's go over this very briefly. A randomized controlled trial takes hundreds or thousands of people, and they are randomized into a variety of groups. Usually 2 groups is the simplest one, based on, and they control for things like age and diabetes and history of heart disease or prior heart attacks or strokes. They control for all these factors to make sure the 2 groups are very, very similar in their health. And then one group over here that looks just like the vitamin tablet, but it's a placebo. It doesn't have anything in it. Okay, you understand? The people don't know which group they're in because they're getting pills that all look the same. The doctors that give the pills don't know. That's called double blinding. The doctors who are evaluating their health for heart attacks or strokes, or in this case, cancer, don't know which group they were in. And then the researchers take all the data after years of study and figure out, was there an effect there? Did that intervention cause something else to happen, in this case, cancer? That is a randomized controlled trial. That is the only type of trial that can establish that one thing causes another. All the other trials are only showing associations that may mentions like that. They come up negative. I'll give you one example that I studied. That was a SELECT trial. Turns out there were scores of studies showing that men who had good levels of vitamin E or good levels of selenium, or both, had a much, much lower risk of prostate cancer. Scientists being scientists, they said, There's a strong association there, just like those strong associations we saw. I wonder if we could give everybody in this country vitamin E tablets and it would reduce the risk of prostate cancer. And so they checked. There were 35,000 men signed up for this trial. They put them in 4 different groups. One got a double placebo, one got vitamin E and placebo, another got selenium and placebo. 2001 to 2008, this is a difficult and expensive trial to do, by the way. And they follow these men all the way through 2011. I'll cut right to the chase. It didn't make a bit of difference. In fact, those men who were taking vitamin E supplements alone had a slightly higher risk of prostate cancer than those who were just getting placebo or just getting selenium or getting both. It's packaged better by God. That's the punchline. It turns out that frequently a profit motive, they will then try to extract them and sell you a pill of a supplement of some sort that is supposedly healthy for you. And they will tell you many times, look at this strong, strong association. These people who had good vitamin E levels, they had lower levels of prostate cancer. Maybe you should be taking a multivitamin or vitamin E or something of that nature. Turns out, even the question of a multivitamin a day, if you don't have a specific vitamin deficiency, statistically speaking, that multivitamin, and I don't believe this is causative either, but if you look at associations, it increases your risk of dying by about 1 and 1.5%. People, it's packaged better by God. Eat the foods that have all of the healthy things in them, and you will be healthier. Yellow pretty much has beta-carotene in it. You can think of carrots, right? You might have looked on the side of a package and seen beta-carotene listed, haven't you? That's only one type of beta-carotene, or one carotenoid. There are literally hundreds of other carotenoids that we are aware of, but we don't know exactly how they work. But we know that they seem to be healthy based on strong associations with hundreds of thousands of people. I gave you a little link here that you could go to. I like AICR.org. It's the American Institute for Cancer Research. That's a group of people who are dedicated. Just spoiler alert in case you go there. They're not going to be telling you that if you have cancer, you can eat a bunch of Brussels sprouts and cure your cancer, because it's probably not true. They're very scientific, very science-based, and I just copied a picture off of their website. They have all the data for all these different fruits and vegetables, and whole grains is up there down at the bottom, and beans and nuts, about how these foods can decrease your risk of cancer, and it can. So there's good data out there that foods can decrease your risk of cancer, but don't go trying to make up for lack of a healthy diet with vitamin supplements and extracts. Statistically, it'll make you worse, not better. Make up for it. But anyhow, here's the next misconception. There's a simple cure for your cancer, available for 12 easy payments of $19.95. You laugh, but friends, this is a serious problem. Cancer is a very complex subject. I've showed you many different types of cancer, and there are many charlatans out there who would like nothing better than to part you from your money. And cancer is a very emotional sort of subject, and otherwise intelligent people, especially if the doctor has told them there's nothing more I can do, are tempted to waste their money on things that are not helpful. That same church out in California, I had a very good friend. She's a year or two younger than I am. And she strongly believed in lifestyle and things. At a very young age. She was younger than 45, I assure you. And the physicians made some recommendations, but couldn't promise her a cure. And so she went off seeking cures in ways that made her worse, not better. And I'm sure that she wasn't the poster child on the front page of those shiny brochures that came from Colorado and Mexico and other places touting cures for cancer. If you want another resource that I recommend, I don't claim to agree with everything anybody says on the internet, but quackwatch.com is a good place to start. You can probably find a lot of information that would be helpful in avoiding quackery. quackwatch.com. Let's finish with a few philosophical misconceptions. I know we don't really say we believe this, but it seems that a lot of us have this idea in the back of our heads that good people don't get cancer. Or at least, I'm a good person, so I won't get cancer. And I think we know that's not true, don't we? Job was a good person. Look what happened to him. Now, along those lines, prayer will always cure cancer. I believe in prayer. I don't mind telling seriously ill and call for the elders of the church and have an anointing service. That is not a lack of faith. It is what the Bible says to do. But will prayer always cure cancer? I think all of us understand the answer is no. Here's a biblical example that I don't know if it'll be helpful for you, but it was kind of new to me. How many of you have heard of the Apostle Paul? Has anybody in here not heard of the Apostle Paul? Okay, so there's a few of you too lazy to raise your hands. The Apostle Paul did miracles, yes? It tells us in Acts 19, verse 11, that he did lots of miracles, and it refers to his miracles in the book of Galatians and several other places in Acts. Paul did lots of miracles. He even raised an apparently dead Eutychus who fell from the third-story window, right? I mean, he did lots and lots of miracles. But the end of 2 Timothy, Paul mentions something just in passing. It's one of those verses we don't even mention much. We don't notice it because it's, one of those hard. One of Paul's close companions that was traveling with him, that was helping him in the gospel. Paul didn't work a miracle to cure him. Miracles don't always happen, even for the Apostle Paul. It wasn't a lack of faith for Paul to have Luke associated with him traveling around. I do believe in miracles, and I do believe that God answers prayer. I believe we need to understand James chapter 5 and what it really means. A third philosophical misconception, in my opinion, is the idea that conventional medical treatment is bad for whatever reason. Some people think it's not natural, some people think it's toxic. It doesn't matter, but they're toxic for sure. But people say they think it's not natural. Some people might think it shows a lack of faith to go to the doctor. I think all of those are a misconception about the proper role of medicine. And I think studying the life of Paul and how he interacted with Luke would be of benefit. Finally, the idea of toxicity. No doctor is going to recommend a treatment where the possibility of toxicity outweighs the possibility of benefit. All doctors swear an oath to first do no harm. And so it is true that some treatments are toxic. There are certainly side effects to pretty much 100% of what I do for patients. But no doctor is going to do something where they know the toxicity is going to outweigh the possible benefit. Now, it doesn't mean that there aren't treatments that aren't toxic. There are, certainly. But there's also benefit there. I hope that risk-benefit analysis kind of makes sense. Let's summarize. Cancer is bad, yes? Cancer is horrible. Lifestyle medicine, which is what you're going to be talking about here for the next many weeks with lots of excellent, excellent lecturers. I'm just excited just looking at some of the topics here. Lifestyle medicine is powerful at primary prevention. That is, tests are still necessary. And what percentage of cancer is preventable? Diet alone is 35%. Smoking cessation's a third. Probably at least 50% of all the cancer in this country, probably even a little bit more than that, up to 70% of some cancers like colorectal cancer can be completely prevented. I don't think I'm going to be able to take questions in this venue, but I'll be available afterwards, and if any of you want to ask specific questions or you want to look at some of the slides more closely, I'd be happy to meet with you afterwards. Thank you for your attention. And I just want to wish all of you the greeting that John did. I wish above all things that you may prosper and be in health as your soul prospers.
For one, we should no longer buy oil from Norway. But in reality, association does not equal causation. That was such a powerful slide, and really it it paints such a picture for us to consider. Lifestyle is what it is. You know, here in Lansing, here in America, in this world, we're at Crossroads, and we need to make and consider some serious lifestyle changes in order to benefit our lives and for those around us lives. So just a couple reminders for you. Tomorrow night, we will be digging deeper with Vicki Griffin, where the study will be, where is God in the midst of the mind-gut connection? How what we take in impacts and influences our minds. We want you to invite your friends. Did everybody feel like tonight was a pretty powerful lecture? Did you learn something? We are at the crossroads, my friends. Let's make decisions that will help us lead healthy lives. Let's educate ourselves. I'll be the first one to stand up here and say it's easier said than done, but the more we know afterwards, and if you'll just bow your heads with me real quick, we're going to pray and then we'll let you go. Father in heaven, we are so thankful for the information that's been presented this evening. Father, we pray that as we continue to educate ourselves, that this will help us to make better decisions in the lives we live every day for those around us. Help us to be more like Jesus. Go the other opportunities that we have to come to learn more about you and about your plan for our lives. It's in Jesus' name we pray. Amen.